So ladies and gentlemen, once again, welcome. I'll begin the recording for the benefit of those who will not be here. My name is Samuel Munyui. I work with the African Institute for Children's Studies. I'll briefly describe who that is and also give you a background to the findings that we are sharing in terms of who did it. But really appreciate your you accepted our invitation to join in this call. We think this is a very important conversation, and therefore we do want to hear from you also on what you think about it. So as you may have seen in the invitation, we want to share with you findings from a study that we've undertaken between September this year and November. And it is about perception of local actors in East and Southern Africa on the quality of their partnership with international actors. I will indicate to you the methodology, how we did this work. And I think for us, it's just a beginning point. When I say us, I'm referring to the Consortium for Reimagining Humanitarian Action. This consortium currently is comprised of 11 member organizations from 5 countries. And these countries include Kenya, Ethiopia, South Sudan, Somalia, Mozambique. And we hope with that we can expand this. You may be familiar with a global focus now on localization or locally led interventions in both humanitarian and development setting. COVID made this awareness even greater than before. Because we realized that during COVID, however well-hearted you are, you wouldn't have been able to, travel and go and provide humanitarian service or, just any regular development service that will be required. And therefore, the need for this kind of a locally led intervention was made much more prominent than ever before. And therefore, we think this is something that we ought to do and encourage more. I know that this is not the only consortium that is trying to promote locally led interventions. There are others, and the more the merrier. Perhaps we need to strengthen the network. So if you're in one of those, feel free to reach out to us through the Secretariat, which is African Institute for Children's Studies. I also want to thank Save the Children for the regional office for supporting this initiative financially and even technically through some of their structures, such as the Humanitarian Leadership Academy. Now, as you can see here, the Consortium for Reimagining Humanitarian Action has 3 key pillars through which it seeks to reimagine, really make sure that the way we respond to humanitarian actions is more responsive and more consistent with what the local needs are. And here you can see there's an element of community engagement, then there is evidence generation, and then there's advocacy and influencing. So those are the critical approaches that we are using to be able to influence the way we work. Like I mentioned, the Secretariat is African Institute for Children's Studies. And this is an African organization, first registered in Kenya, later on in Zimbabwe, in Uganda, South Sudan. And we work also with a lot of partnerships in other countries. We pride ourselves as a Silicon Valley for children, basically being able to be the place where you find solutions around children. Now, when you go into the element of partnership, why are we looking at the quality of partnership? This is because partnerships is about people. It's about institutions that are able to bring the change. And I am often reminded that when you talk about people and products and institutions, it is very important that whether you're running a private sector or a public sector institution like most of us are doing, that there are 3 Ps. There is the people, the product, and profits or impact. But often, even in private sector, you will find that there's a clear focus on the product or the intervention that needs to be done. A clear focus on profit can easily be defined, or the impact that we want. But the people pillar is often very much neglected, and not enough is put on it. And so when we are talking about partnerships, we are talking about how do we enhance the people pillar? How do we ensure that institutions are able to work together? Again, like in the case of COVID, you may have had a solution, a product somewhere, but you will not have been able to make it accessible if you are not working with the people across. And we know that in the SDG, it's reiterated the importance of partnerships, people and institutions across the globe being able to work together to be able to address that. So this was our motivation, that we said, while we are promoting localization and locally led interventions as the CRHA, the Consortium for Reimagining Humanitarian Action, we do need to look at the quality of partnerships between local actors and international partners. And this is why we have put this together. And we hope that you can take back this information to begin conversations again, to just renew and recheck what we are doing about ourselves. Now, like I mentioned earlier on, we conducted this study between September and now. What we did is we developed a tool for data collection, and this was using an online portal, Google Form. And our tool used parameters that are already agreed upon at global level by most partners. And these are principles of partnership. What makes a partnership to be efficient, to be effective, to be responsive to the needs of both the local and the international actors who are part of it. And as you can see in the second bullet, that some of those globally agreed, again, I understand there are a bit of school of thoughts on this, but what cuts across is that there should be equality in a partnership for it to be meaningful, to be one that can be able to contribute to an effective locally led intervention. It needs to be transparent. There must be transparency. There must be result-oriented approach, and I'm going to unpack that to look at what people reported. It needs to have a sense of responsibility and complementarity in the relationship between, especially the international and the local actor. When we reached out and shared this online form, and this was also partly because of resource limitation, we couldn't be able to go from every other place, every other country, and there may be an issue of limitation in terms of representation. But I think overall, because we shared this in, for example, the African CSO Forum, we shared this in national networks through our partners in the 5 countries where we are in. We also shared it in other special interests, social media groups, WhatsApp groups such as the Arid Land CSOs, and we were very deliberate on reaching the local community level organizations. Yeah, in Kenya, for example, we have the Children Agenda Forum, which has over 142 members. And I will therefore say there was a good attempt to reach out to many of these. In total, we had 41 organizations responding on this. The other important thing we wanted to collaborate is to use the key informant interviews. So we reached out intentionally to some of those who responded and asked them to do a key informant interview so that we could explain and try and triangulate the quantitative and the qualitative data to further understand what could be the reasons that could have led to what we had. So at this point now, I'm going to go into describing the results, what we found out, and now take your notes. I don't have very many slides, they're just about 12. After that, I will invite you to begin giving your own insights in what you think we did. Now, this was actually not a key aspect of the study. We did not set out to understand the representation of organizations, but we found this data a bit interesting, that most of the organizations that responded despite this very open and accessible way of answering the data, were those that were 15 years and older. And also that majority were NGOs, followed by CBOs and faith-based organizations. But then that to us really raised some concerns. Is it that the use of online and digital platform is a challenge for community-based organizations? And just appreciating that funding and international relationships are more and more going digital. It then worries you that if you're out there as a funder, or you're out there as a partner who wants to come and contribute, are you likely to reach the person who is really on the ground and is able to respond as a first responder? Is it that they were just not interested? Is it that there were too few people who are able to respond? And I am privileged to be a founder member of my organization. And for some time, I was alone in the office. So sometimes those could be limitations that can emerge in the relationship between those who want to contribute, as international partners, vis-a-vis the opportunity to reach out to the person who is really on the ground. So I think this was a telltale sign for us. It could also be the fact that maybe there's something about organizations and the ability to stay longer. And I think like in business, we believe that there's a high attrition rate generally. A lot of organizations don't survive beyond the first 2 3 years. And this could be linked again to how they are resourced. I recently had an opportunity to evaluate HIV projects in Kenya, funded by Global Fund. And we saw something very interesting, that organizations that have, that started 20 years back as a briefcase NGO, as sometimes we call them, a one-man show, with barely even being able to manage a $10,000 annual budget, are now able to run over $1 million budget, up from one person running to over 50 people being part of this. But the thing that stood out in that is the Global Fund has been very consistent in reinvesting in the same organizations. And we see this as a probable reason why the representation of the local, especially community-based organization, often becomes a challenge when you want to try and understand what's going on at national and regional level. So I thought I would want to hear from you. Is it just our bias? But the way we gave this opportunity, I really do not think it was just the bias. Now, I'm going to go now into the principles that we did assess that will tell us the quality of the partnerships between the organizations. We've selected a few of them, and I begin with the principle of equality. So by a global definition, when you talk about the principle of equality, you are referring to that both national and the local actor and the international one have equal role, one in decision making, in influencing, and in responsibility. I think those words are very deliberately chosen. And we did notice that when this question was asked, do you think there is equality in that? You can actually see a majority are disagreeing that there is equality. Okay. Of course, fairly good number are saying agree, but luckily not totally disagree in that or that. So the general trend here we're saying is that there's a feeling that there is not a fair relationship. There is no equality in the relationship between the international and the national or local level organizations. Now, again, going back into the qualitative data that we had from the key informant interview, one of the things that emerged is that a lot of the funding currently or partnerships come in from a very restricted funding model. And that many times does not leave the local partner with an option in being able to make decisions. the irony of this is many times you'll find that these international partners or those who are funding will also demand that there is participation, especially of the beneficiaries in decision making. But where you went and received a grant for a very specific thing, even sometimes activities prescribed, it is very difficult to go back to your community and say, what do you really want? And of course, sometimes we are working with the intermediary, international partners who have raised money for a very specific thing. So they themselves are already restricted. So the flexibility in decision making is already lost right from the point of raising the grant, even before it gets in at the community level. And therefore, some of the proposals here that are being made by the local partners is that we should improve the transparency in that communication and really be very clear and say, look, as much as we are demanding that there's going to be more flexibility, more opportunity for us to make decisions, can you give us that? And where does that come from? That many times only works where there is a greater proportion of unrestricted grants. That's when it works. So the more we keep coming in with grants that are limited to what must be done, it's been signed at almost the third level of, the trustee that is giving the money or the donor into the international agency, back into the local, then into the community, the lesser the opportunity in inequality and in decision making and influencing. So this remains a major gap, and I'll speak to it also as I do my closure slide. Let's look into perceptions of the local agencies as to whether the principle of result-oriented actually works. Now, this often refers to having very concrete outcomes and measurable impact. And given it is a good thing to have. Look at the reactions of the local actors when they were asked about this. So overall, there was a varied feeling. One, that yes, it is there. There is an element of result-oriented, but that because of that, again, it's linked to the earlier principle we talked about, that there is no flexibility, that it comes in with a very straitjacket. Sometimes the outcomes that are important are predefined at the level of the international partner or the grantors, or the donors for that matter. Now, when we sought to understand from the local actors what will be the most important outcome for them, I think the thread that runs through is international and local partnerships must bring about dignity in people. It must bring about the empowerment of the local person so that with time, we're able to exit. This is one of those that is often required of us to write in documents. You'll be asked to write, what is your sustainability plan? But we know what sustainability plans mean. It means you're telling the partner that they will have no role, or even the organization, they will have no role after some time. Very difficult to achieve, but a good goal. And therefore, while results are often defined and there's a result-oriented approach to partnership, it many times does not build on what is most important for the organizations. Again, going back to the example I gave on the HIV partner organizations that have operated in Kenya over the last 20 years, they've been now put to a point where they are able to actually receive the grants. And many times you will hear that the challenge in doing locally led interventions is that the local organizations don't have capacity to even use certain amounts of money. You can't spend $1 million, so you're not good enough, or your systems, your institutions are not strong enough. Yet you will realize that, again, listening to the responses that came from the key informants, that many times, while capacity building and leaving an empowered local organization is a critical result that should be tracked by both the international partner and the local, that many times the amount of resources that are put on that are so minimal. You know, many times less than even 5% is being put on capacity strengthening. And it's not that money always has to be the thing to be put. That was the other good thing that was emerging, that it should be possible to even use things such as, you know, sending in experts to come and work, building systems. You know, we've seen projects, and these again were examples being given, projects that have required that you have a very enhanced financial system that is able to track expenses from the field all the way. That is right. But to invest in that, sometimes you will need over 10,000 shillings, $10,000 to be able to do that. So demanding that outputs about the individual become the priority is often a challenge. An example that was given in one of the key format interviews is sometimes even where there is unrestricted grant, the local organizations, when they're given that chance, you will find them investing in increased number of beneficiaries instead of investing in the systems. Why? Because we've had a culture that has demanded that you demonstrate to the funder or to the international partner that you are the greatest level of efficiency. And it's often numbers. And therefore that can water down the importance of the results that are expected in this kind of an intervention. And therefore we think there's need to really reflect and ask ourselves, who decides what are the outcomes? And how can we help the local organizations to realize the most important outcome, which is building dignity, building empowerment of the communities, building systems, so that if we want to see more local organizations with capacity to spend $1 million, then let us be deliberate that that will happen in 10 years from now and work with a few of those over a long time. So instead of spreading support to many organizations, that we could have few, but, you know, so it's called narrow and deep rather than thin and spread out kind of grant models and support. Let's go to, I think, my second last or third last, if I'm not wrong. The principle of capacity building. Again, I've mentioned a bit of this in passing. And this, when it was asked, you can see that there's a bit of diverse feedback and diverse perceptions on whether there is capacity building or capacity sharing at both organization and individual level. So generally, I think this is one of those that we've seen that there are those who've been able to identify things such as staff, financial, logistics, as being part of what has been contributed by the international organizations. And the question of the capacity, therefore, to manage the resources came out again very strongly as an area. And the ICR was one of those that was pointed out here, where we put a certain percentage to allow the organizations to spend not directly on the project. But often, one of those examples that was mentioned by the local organization is that the founders of these local organizations many times do not have the opportunity to be supported directly. A lot of grants will come and say there is no money for the CEO, or there's only money for the program manager. So what sometimes has happened is that you will have the CEO, you know, have a role in the program implementation. And many times that sometimes is the only grant they are receiving. And therefore, it really limits their ability to have the founders and the vision bearers to keep their eye on the vision building and building the networking, and they're forced to come back into implementation. And what happens is a lot of these organizations, by the time they're done doing their 3 years of a grant, they did not build on any other grant, you know, so there's no opportunity to continuously invest in more division and networking. So this was one of those that really there was a call to include limited investment in things that allow the organization to be sustainable, and not just a focus perhaps on trainings as we've often done and on the program team only, but also those who started these organizations. Let's go to the principle of flexibility. My second last, yes. On this, it's defined as a partnership that allows adaptation based on changing circumstances. What do we see here? Overall, there's a feeling that, yes, there's considerable flexibility and adaptation in programming. But then, so it's not fully, as you can see. Now, some of the insights into this is that flexibility and adaptation among the respondents are often very, limited to the whims, and there's still a lot of controls going back into the donor institutions or the international partners. There could be flexibility that are allowed within internal policies, but again, sometimes some of the issues that were raised during implementation of such, that you will find that the policies of the local organizations are not given that space to be able to be used to make decisions. A lot of times the bar setting is often done by what will secure the international partner. And therefore, that became an area of concern. But of course, there's a lot of willingness to improve the local policies and make them work. Again, the importance of flexibility was underscored, especially given the COVID response. And again, the emphasis on mutual respect, that wherever there's need to be flexible in policy frameworks, in how resources can be used or cannot be used, it must be done from a very mutually respectful space. And therefore, the need for a continuous negotiation was emphasized, as a very critical element of flexibility and adaptation. There is the principle of long-term commitment as an important aspect that facilitates a responsive relationship between the donors and the others. Now, here you can see really quite some varied perceptions. So was there a feeling that there is a good level of commitment from both sides? You can see that those who are saying fully committed, just a few, less than a quarter. And most projects are really short-term, especially the lower you go. At national level, you will find organizations getting partnerships that go for 2-3 years. But the lower you go at community level, they're very, very short. And again, back to the example of the HIV sector, unless we're very deliberate. And when we become predictable, then it becomes very, very important for the local organizations to be able to thrive. Yeah, so and again, the beauty here is it can go beyond the money. The idea is that we not just talk about money issues, but also strengthening, the spaces, giving spaces where these local organizations can be able to influence the decision making. But long-term commitment, at least ranging from 3-15 years, was indicated as something that really is required for this to work. Okay, I realize I'm becoming a politician. I keep saying, now I'm finishing. Now this is the last one correctly. So a principle around a culture of sensitivity. So this takes into consideration sensitivity to local values, that at project design and everything, that we must be extremely sensitive. Generally, the perception is that, about a quarter saying, yes, this is extremely well being done. So again, 50% are reporting that this is being done, which I think is very important if you're going to do locally led interventions, that you must appreciate that local cultures will be taken into account, especially local knowledge. Many times this has been ignored, and you do interventions that are not responsive, or the community realize that because you're not very interested in what is most valuable to them, they just come and tick the box. They'll come into meetings, receive their little allowance for transport, not because that's really what brought them, but because they realize, after all, it doesn't matter. So this is also linked to the other principle around how much are we having flexibility, how much are we communicating, and being able to be responsive. But it looks like one of those that scored the highest in terms of those who agreed that this is operational and it is working. There are issues such as the language proficiency, very, very important. Diverse teams, that within the teams that are coming to work in a project, there must be diversity, continuous learning, and having research and building on what is working from the bottom up in terms of program design. So what do we therefore see as some possible ways in which we can enhance this relationship? One is to build on a growing area of practice, which is called trust-based philanthropy. Now, there are certain principles on trust-based philanthropy, as you can see them here. It is that, one, that it should be a multi-year unrestricted. So with, the feedback that we were getting from the data is, let's consider more multi-year unrestricted support. But let's consider that the donors are able to listen more and really listen meaningfully. And that, when you have unrestricted grant, then it's possible to allow people to design, in a very participatory way, knowing that they have a full control of that decision making. Like we said, that questioning around the capacity issue, do we have capacity to do this? It is very important. And I think the feedback we're also getting is the local organizations are not saying they should not be held accountable on resources that are given to them. Many times it's public resource. But the due diligence burden should be reduced so that then it is easier to also go and support those institutions that don't even have as good structures, but with a clear mind that with time we want them to get to a certain level and build their own systems that are also most responsive for them. And then having reasonable monitoring and evaluation requirements, like we said, the results and outcomes that are expected should be responsive to what builds the specific local organizations. And then the transparency and responsiveness and providing assistance beyond a grant. That it's not just the money that is important, it is the relationships that are made between these various partners. So I think with that, I want to stop there, and I will invite, any responses, any questions from our data. Let me at this point enable you to unmute. So please go ahead. You can type in the chat box. And please remember to register in the link that we provided. My colleague Martin, who is a program manager for this CRHA. Martin, if you have anything to add, again, feel free to add, and you help me track out any question. Over to us. Feel free to ask questions. I also saw colleagues from CRHA here. Please, if you have any thoughts, including Edwin, who's been very supportive from Save the Children. If you have any additional thoughts, I'm looking out for hands that will be raised.
Thank you, Sam. This is Edwin Kiprop from Save the Children. Thank you so much for this study. I think it gives us a very good insights, especially as international organization, just to have a perspective of how do we particularly improve our partnership with the local actors. And I think that being our ambition currently, that we want to increase impact, or rather have great impact while working within the region and also working with the communities to ensure that we alleviate a lot of issues that are happening within our communities and our societies. So basically, I find this a very useful information, and I know Sam and the CRHA team will be able to share the findings widely, so that we be able also to learn from and be able to see even the recommendation that some you have shown us, especially on areas of collaborations and trying to, to go deep and narrow and all that will also help us, especially even when we are formulating and also trying to link the communities and local organizations in the quest of, trying to reimagine humanitarian actions within the region, and also support the local organizations, support the communities, and ensure that they are sustainable, have responsive programs that would not only help the community, but also support the children that are within our communities. So from my part, I want to say thank you so much for the team that did this. Thank you for the analysis, and we hope to, to take this further as lesson learned, and also try to do a sort of what can we do now, having learned this information, having these insights, what can we change? What can we do to better the collaborations? What can we do to ensure that we have equitable partnerships and partnership of equals, and in the process of trying to increase impact within this humanitarian sector. I know with this, we are very much focused, or rather eager to keep our programming in a process where we involve evidence, or rather we do our implementation or programming through action oriented, based on the evidence that we gather and evidence that we have. So with this aspect, we would like to really, because this is a product of a research that was done, it would really be important that we continue this action research approach, where we do research, we get some insights, and of course use those insights and evidence in our programming. Thank you, Sam, and over.
Thank you, Edwin. And indeed, we mentioned there could be limitations from our own study, and we hope that we can have more partnerships, reshare the tool, and let's see if you can do country specific, and we'll help you in the analysis, and let's see whether there are variations between countries. Mulume, thank you. Go ahead.
Yeah, thank you so much. My name is Castes Mulume. I'm the Humanitarian Program Officer for CRHA Africa, and I'm very happy that I'm participating in this, because currently we're also organizing a research on localization and what does it mean to the local actors. And I want to agree with most of the areas which you have raised. Indeed, the local actors, communities or local organizations have the local knowledge. They understand the context. And what has been observed over time is that partners would want to implement on their own, and citing issues like local partners don't have the capacity. Because of this, they have gone down. But what you're saying is, what should the partners do to empower the local actors? So I want to agree with you, the issue I've talked about, the issue of capacity building. And capacity building, not only one year or so, but long-term program, as you have put it. Because in that way, you move with the people through and through up until they get to a level whereby they can receive funding. But also, what I've seen also is that international organizations, instead of working with the local partners, maybe to access the resources, they would want to also compete with the local actors. This is another problem also. You see a call for proposal, for example, there's WFP. Instead of building capacity for local organizations, they want to go and also compete. When they get the money, they want to go and work with the local actors, we see we want a scenario whereby international organizations can come in and build the capacity of that organization so that they can access the funding on their own. And if there are gaps, it's the duty now of the international organizations to support in the capacity building in those areas. That way, I think we can make localization a reality on the ground. Thank you.
Thank you, Castan. You remind me that, and I think this was mentioned in some of the key informant interview. I think AMREF and CARE International. I'm giving examples in Kenya because I live in Kenya and I see a lot of this. There is the KCDO also that had about 10 years program interventions that focused on capacity building, the local CBOs, and a number of those CBOs are now at an NGO level with much bigger capacities to manage. So I think being deliberate is very important. Thank you for also raising the concern around the international organization now becoming the local organizations, because there's a shift globally to have funding given to the local organizations. And we've seen that where international organizations now are registered as a local, and it therefore beats the reason and the meaning in terms of having the local persons to be able to grow in capacity. And being first responders, I think we must always appreciate that it's about being a first responder, having local knowledge, and being available in the community. So thank you for that. Joseph Okuya, your hand is up.
Thank you so much, Sam. I really want to appreciate such a research, and it enhances self-awareness when we know, or when it's known what challenges we go through. I know sometimes when the prerequisites are too many, qualification of organizations to get funding and establish helpful partnerships can end up being perceived as being an area of competition, because by the law of supply and demand, when we have a challenge in a perception on availability of funding, then there's organizations that are there, grassroots, start scrambling for qualifying to be able to meet the needs of these donors. And so once we understand challenges that are there, I think it speaks to both sides, speaks to the local organizations, and it also speaks unto the donor community. I'm glad a few of them might be listening in on this. And those challenges, at the end of the day, start causing jostling among the organizations that would have had good ideas that would have been kind of incubated to be able to be grown to serve a bigger area and a bigger purpose. So mine is just to appreciate what your research has done. And I think research in many more areas that unveil a lot of self-awareness helps us to understand one another, understand the circumstances that we go through, and also the donor community to be able to appreciate us. I didn't introduce myself where I work. I work with advocacy for incarcerated families, and we work with families of people who are in prison, especially women and children. And we have seen this as a challenge even among our organization, to be able to grow up beyond those levels of barriers. You might have a good idea concept, but because the prerequisites are really overburdening, you may have that just remain as a shelf idea. But I thank you, such like research normally brings out to better understand and have the groups, players appreciate what we actually are faced with in day-to-day life. Thank you so much.
Thank you, Joseph, for that. And indeed, we will really encourage even population-based organizations to undertake the same study. Let's see what are the issues, are they similar? But you also remind me of the need for us as local organizations to tap into our own public financing. Are there opportunities for funding by the public? If you're in Kenya, for example, we've introduced in the Children's Act 2022 a child welfare fund that should allow local organizations to get money from Treasury and play a role. Of course, with that often comes the question, will you have the flexibility and the autonomy, to check the government as a civil society organization? But I think we need to demand more from that, and also be able to access private funding from local sources. So thank you for that emphasis. Godfrey, your hand was up, and then we will go to Ahmed and maybe finish at Stanley. We have 8 minutes left. Go ahead, Godfrey.
Yeah, thank you very much. The second part of my comment you have already talked about, that is the focus on local funding, particularly coming through our government, but also in light of the fact that even the money that we're talking about that is provided to us by international donors, international funders, the bulk of this money actually does come, or a significant portion of it does actually come from their own governments, in the Western capitals and so on. And of course, as you said earlier, a decision that was made some years back shifted a lot of this funding now to Africa, and therefore a lot of these international NGOs have also shifted base, to Africa as a means of really tapping into these funding opportunities here in order to be able to work with their local partners. We are one of the beneficiaries of that. I work for CRHA Uganda. And of course, apart from the issue that was raised by a colleague before my colleague here, the one that I'm following, spoke, it's true. I should agree that one issue that I think raises a lot of doubt that makes it extremely difficult for us to access this funding directly is a question of capacity. So whether that capacity is imaginary or real or both is another question. I know it's both probably. But also an element that is very, very interesting, is very, very important, is the element of trust. Trust, I think that's very, very key. I think trust, the fact that many of the Western governments don't very much trust the local partners. And I think something with that we must not ignore. And why are they not trusting the local partners? They're not trusting the local partners not simply because of capacity gaps, but also because of matters of transparency and accountability itself. Because we operate as NGOs in Africa within a political frame where, for example, in many of the countries, corruption is glorified. And so that mistrust in our own governments and our own institutions here locally does have an impact in the way they look at us, they perceive us, even as the non-state actors in these countries. And I think that's something very, very important. Now, I want just to give an example. If you're looking, for example, the Global Climate Fund, to date, very few African countries can access this money directly. This money actually comes through intermediaries. Here in Uganda, it comes largely through the UNDP. You can just imagine. Our own government cannot access that money directly. So just recently, they've been trying to open up, to make the conditionalities a little bit less stringent, the demand, and so forth. And so in order for us to access this money directly. But you can just see what is at stake here. It's not that our governments cannot manage this money. Our governments manage big funds, but it's a question of trust. And that mistrust as the source, as you know very well. So this is something I would like us to take note of. I don't know whether I've not had it in this survey coming up as one of the challenges. Thank you very much.
Thank you, Godfrey. You remind me, one of my early years of working was in Liberia, and I was told of people who received their first $6,000 grant and went to the US. So I think there must be, we could dedicate the next phase of our research and sharing on really how do we build trust. But I think one of those that we've learned, even in community-based organizations, is where you work with a peer and community-centric kind of approach in doing programming. So it goes back to that question we had of, is participation, for example, really meaningful? When you come with the restricted grant and I can only go to the community because I've written a proposal, it gives me an upper hand and I'm guided into what I can. So thank you for raising those. I think I will want to dedicate the next research and webinar on that. How do we really build trust? And like I gave the examples of HIV that has invested in organizations, now they can be trusted because the systems have been built. Ahmed Hassan, SND.
Good morning, everyone, and thank you very much for giving me this opportunity. And I'm so glad that I've managed to join this session and get the outcome from the study. My name is Ahmed Ali. I work with the SND Africa. We operate both in Kenya and Ethiopia, and we are actually based in Moyale. On the presentation that you've shared on the study, I feel it is quite timely One, because the discussion is in high gear about our engagements as local partners with these international actors and donors. And a few things that has come out very clearly, and which I feel it should pose as a challenge and to all of us in terms of preparation for us to take over or to accept the devolved, which I think the convention should be the international actors and donors should devolve most of the functions that have been taking over and also the finances. Some of the key things that has come out is basically, the perspective on the diverse perspective in terms of our partnerships from the local organizations to the international partners and donors. Our challenges, I think it's very clear that we all have concerns in terms of our engagement and imbalances in terms of power and unequal resource distributions. Issues about capacity building has come out very clearly, even with my previous presenters have mentioned. It's good that we prepare ourselves by enhancing and building our capacity to take over or to absorb this kind of funding, and also, to portray the impact in terms of the local communities in terms of this partnership and how we are implementing it. Just to give a very brief on some of the issues that has come.
We lost your voice.
Out from the study that you shared, a concern. Sorry, am I back now?
Yes, you're back.
Yes, I was saying some of the concerns which has come out from the study has been in discussion for quite some time, and I'm quite lucky. Currently, I'm attending a 2-day meeting on Charter for Change, and the main subject has been about localization, and this has come in the wake of all these studies and all this concern. And I'm so glad just to share with the other participants some of the key 8 commitments which has been made by partners and international donors. One is the direct funding, and I think there is a commitment to pass 25% of humanitarian funding to national and local NGOs, which is a positive thing, to reaffirm partnership and principles. The recruitment has been quite a challenge. They're addressing and prevent the negative impact of recruitment of international NGOs poaching from the locals NGO after we've struggled building our own capacities. These some of the committees they made. Issues about advocacy, emphasis on the importance of national actors and humanitarian donors. Transparency has been one of other commitments. Equality, addressing issues of contracting and ensuring equality in decision making. Support, providing robust organization support and capacity building. And finally, which is very clear and which has been affecting a number of us, is the issue about promotion. Most of the time, we do the work, we do all the donkey work, and we are not even recognized in terms of branding and visibility. I'm so glad that this has come at the right time for us now to, to emphasize more with the study that you've conducted, to push on all these commitments to be realized. And I hope this will happen quite soon. And even as we're engaging a number of them, let us also go back to our organization and institution, strengthen our system, strengthen our capacity, be ready to take over and absorb all these devolved funding, human resource capacity and skills, so that we can implement or we can serve our people. Because at the end of it all, it is us. So in the spirit of localization, let us be prepared and engage more. Let's be positive. Let's take this study as a foundation for us to present our arguments and our case. Thank you very much, and back to you.
Thank you. Thank you very much. So I know we are a little over time, but kindly, because we started 5 minutes late, allow us just another 4 or so minutes and we'll finish. But Ahmed, thank you for raising some very pertinent issues. As African institutes and the government of Kenya and a number of partners, including UNICEF and others, we just hosted an international conference on child protection in Africa, the second one. If you go and check www.icp conference.net, I'll put it on the group. You will see that one of the challenges that was raised is linked to what you're mentioning, that sometimes we even generate evidence and you publish in a high-tier journal that, I remember we did a meta-analysis on responding to matters of maternal child health. And to publish, we needed to pay about $3,000 for our paper to be published, so we couldn't afford. And even when it is accepted on, humanitarian ground, for me to access it and tell my government to access it, I still have to pay. I have to be, which you can't afford. So we really have to ask ourselves as local organizations, where are we going to? How do we build our own local journals? And not because they'll be lower in quality, but we are deliberate in creating space for us to share our own knowledge and not have our knowledge taken over. Plus, like you're saying, building capacity of our staff, and then they're taken over. So thanks for raising that. I only saw it more in the nurses, but now it is true. It's also among CPOs. Thank you for that. So two last people, and then we will close this. Is it Chibe from Caritas in Zambia? And then we'll finish with Stanley.
Yes, hello. Thank you. I'm Chibesa from Caritas Zambia. And like everybody has said, I'll reiterate that timely research. For Caritas, I think I just want to add the voice that we equally relate, because right now we are actually at a time when we are having these talks of how we can become prime or a leading organization that's able to, handle even funding and be able to just, channel it to other organizations that is responsible for ensuring that we are a leading organization. Now, I heard that, sorry, I had a problem with connection, but somebody mentioned about the issue of where we have even international organization also, fighting for funds that local organizations are trying to get. And that's the discussion that we're also having as Caritas right now. But the focus really mainly, I also reiterate what others are saying, strengthened institutional capacity, I think, is key for us at this particular moment. And so it should be for a lot of local organizations, because it's very critical, so that we could enhance our systems in order for us to be leading organizations, so that we can be trusted not only with being able to execute the work or do our work, but also to be able to hold large funding. Okay, and I think that's the route really that most local organizations need to take, just to reach a point where we are shaped enough to be prime, and we have strengthened institutional capacity, we enhance our systems, that we can be leading local organization. I think for us, that's as Caritas, it's really, really key that we could reach a point where we could meet the standards. We're just able to, be able to host huge funding and be able to administer accordingly.
Right. Thank you, Shibe, and we would really love to learn how that is going, because I believe a lot of people who start local organizations, it's going to take about 10 years to get to a point where all the systems are properly done, unless you're very lucky and you get a lot of institutional strengthening very early. So how we do this will be something we need to learn from each other. How do we build trust early enough? And what is really the goal of building civil society? How do we bring the people who are involved to be part of that system? Lastly, Stanley, maybe in 1 or 2 minutes, then we can wind up.
Okay, thank you, Sam, for a wonderful presentation. Mine was just to give us a challenge. Like now, how are we going to make future suggestions so that we gather input on how local actors believe international actors could better support local initiatives? Again, how do we now understand our effectiveness to get international aid? Do we now go and explore on any other areas of success and improvement that can better give us these future, maybe collaborations with the international organizations? So it could be a challenge to maybe go back and give suggestions on how we can improve this study, and maybe work as a team. And to any other people presented here, I'm Stanley Okoth. I coordinate Children Agenda Forum, hosted by the African Institute for Children's Studies. Thank you, and back to you, Sam.
Thank you very much, Stanley. And you put us in a very good space where we are asking ourselves, beyond this webinar, what can we do? So remember, in the registration form, we've asked you to put in your detail, but also tell us, how do you think we can engage? As CRHA, we have a special technical working group that is looking at research and policy advocacy. We are willing to engage with you and to engage with the international partners on really having a phased approach in ensuring that we see models of what works in having meaningful partnerships that are equal, so to say. I've shared in the chat box some links, one to CRHA. I've also shared something that we're developing very interesting. It's called the wiki, like WikiLeaks or Wikipedia. The consortium has a wiki, which is a portal that you can use to share feedback from the public around what they think about organizations, about projects, and also give them feedback. So we want to really enhance interaction to harness the local knowledge on what works in responding to various humanitarian and development needs. So from the CRHA, as the Secretariat to each African Institute for Children's Studies, we want to say thank you very much for making time. We will look forward to writing to each of you who've responded, and let's see how we can build this further and make Africa work for itself. Thank you very much. Thank you. See you soon.
Thank you.